Thanks for tuning into my video again, and thank you also for looking at my Candida Crusher YouTube channel. I'm very pleased with all the amazing comments I've been receiving on my channel, and it's for people like you out there that I make these videos. If I can help people out, and give them some relief, show them some shortcuts to recovery from yeast infection, that's the whole aim of this channel, okay? I'm going to read a little bit out of my book now, the Candida Crusher book, Aggravations and How to Minimize Them. Right? This might give you a little bit of an insight that you don't have to feel bad with treatment. There are many different types of aggravations people experience who come to seek the help of a healthcare professional. Some people come in with one or several pharmaceutical drug-induced side effects, such as after an antibiotic. Others experience a reaction when they stop taking a drug or switch brands of drugs. Many people can potentially develop aggravations at the beginning of natural therapy treatment, and this can be quite discouraging for some people. Those who are used to conventional medicine find the concept of feeling worse before you feel better a bit disturbing, and some find even a bit crazy, particularly those who strongly adhere to the tenets of modern medicine. Modern medicine believes that a diagnosis must first come before the treatment, usually in the form of and then the treatment is usually in the form of a drug, which supposedly cures the complaint by way of eradicating the symptom. Aggravations can come about from several different reasons, and here are 6 examples of common reactions that I see regularly occurring with patients. Number 1, drug side effects that we call iatrogenic disease. Every day in my clinic I see patients coming in with drug-induced side effects. I had a lady today taking the oral contraceptive pill with headaches. Drug side effect. I get patients in with constipation or diarrhea from taking pain-killing medications. I get patients who take sleeping pills that get all sorts of drowsiness during the day. I get patients taking antihistamine tablets that get vitamin B12 deficiencies. The list goes on and on. We get statin patients, taking drugs to reduce cholesterol that get CoQ10 deficiencies. The list goes on and on and on. Every drug has a side effect. Side effects can be horrific for patients, and we call drug-induced disease iatrogenic disease. Number 2, coming off any medications or detoxifying from pharmaceutical drugs. Many people start natural treatment and stop drugs. This can make them very sick if they stop too quick. So coming off a drug or dropping a drug in favour of a natural treatment can create strong symptoms, and these can be seen as reactions from treatment, when in fact they're detoxifying reactions. Number 3, a change in diet after commencing treatment. Many people start treatment and go on these crazy diets, these weird-ass diets. They'll start drinking lots and lots of fruit juice or vegetable juice. They'll ditch all the carbohydrates. They'll ditch gluten. They'll ditch dairy. They'll ditch this. They'll start making major radical changes to their diet. They'll stop all alcohol, all coffee. They'll go on this health kick, and they feel terrible. And then they wonder whether it's all worth it. And the doctor will say, "Well, what do you expect? You went over to the witch doctors instead of me. Of course you're feeling bad." Don't make change quickly. Change needs to happen slowly. It needs to become a habit for you, a permanent habit. Okay? They say it takes 2 or 3 weeks for a habit to become a permanent thing. So go very slowly with the changes you make. Don't do anything quick. Number 4, combining several different treatments, drugs and dietary supplements all at the same time. And this is madness. You can't do that, all right? You need to follow one treatment at a time. Don't follow 2 or 3 treatments at the same time. You can combine pharmaceuticals with natural medicines, but you need to see someone who's very expert at understanding this concept, and who knows what's going to clash, what the side effects from things could be, what the detox reactions can be. Some medicines just don't work well with some natural medicines, so you need to be careful what you're doing there. 5, improperly combining drugs and natural medicines at the same time. This is a real problem. Some herbal medicines just don't combine well with pharmaceutical medicines. St. John's wort, for example, doesn't combine well with antidepressants. So you need to be careful what you're doing, and again, if in doubt, talk to your pharmacist or experienced person, healthcare professional who understands about the interactions of natural medicines and pharmaceutical drugs. 6, cleansing reactions of the body after commencing natural medicine treatment. Oftentimes the drug residues will be cleared from the body. So If we look at the liver is a chemical factory that has two major cycles to it we call phase 1 and phase 2. So toxins come into the liver, they become more toxic, they go into intermediate phase, and then go into phase 2 where they get rendered into water or fat-soluble substances and passed out of the body. So if we look at phase 1, for example, B vitamins are a very important part of upregulating phase 1. So if you're taking a B vitamin tablet, for example, or you're new to natural medicine, you know, you've just stopped the drug or you've cut it down a little bit, you're taking a B vitamin, you could get quite sick, get headaches or diarrhea or constipation or a lot of bloating from doing this. It's quite a common thing. So just be aware that that could occur. You may notice that I've not mentioned a die-off reaction in the above 6 examples, or what we call Herxheimer reaction, i.e. Candida yeast dying off in the body due to effective Candida treatment. In my experience, many people incorrectly perceive aggravations after commencement of yeast infection treatment as die-off. So be careful, alright? Many people I see don't get Herxheimer reaction. In fact, it's not as common as you think it is. Those 6 examples are much more common than a Herxheimer reaction. Even the most experienced natural health practitioners get this whole die-off thing mixed up with other kinds of aggravations. So just be careful. When you're taking a pharmaceutical drug, be careful. If you're switching, you know, from drugs to medicines or medicines to drugs, be careful. Make changes very slowly and you should be okay. Aggravations can be minimized, all right? Try and stick with natural medicines rather than pharmaceutical medicines. And for that reason, I created the Candida range of dietary supplements. My first offering is an antifungal called Candida Remove. I'll be very soon launching my Candida Restore, which is a probiotic enzyme. So these products were based on my nearly 30 years of experience with yeast infection patients. So be careful what you take, be careful what you combine, make change slowly, use intelligence and wisdom when you make your decisions going forward with treatment, and you'll feel a lot better and minimize aggravations. Thank you for tuning into my video.